Today we have Dr. Aaron Levy, who will serve as our keynote speaker. To tell you a little bit about Dr. Levy, he is currently a hospital pediatrician at Atrium Health. He serves at our Levy Children's Hospital, which is based here in Charlotte. He completed his pediatric training at LCI, and although he is now in North Carolina, he was born and raised in Nashville, Tennessee. He completed his undergraduate degree and education at Emory University in Atlanta, Georgia, and followed up with his osteopathic medical degree from Lincoln Memorial University, DCOM, in Harrogate, Tennessee. Dr. Levy, as you will find, has a strong interest in how climate change and air quality health, particularly that of children, makes an impact. He is currently the healthcare advocate on Mecklenburg's Air Quality Commission. He's doing a lot of things, y'all, so just buckle up. He's an advisory member for Clean Air NC. He is also a co-chair for the Climate Health Education Committee at Atrium Health. He's a member of the Carolina Advocate for Climate Health, also known as CACHE. And then last but not least, he is an American Academy of Pediatrics Climate Advocate in North Carolina. So I am surprised you found time to be here with us today. We are glad that you're here. So in addition to all the many things that Dr. Levy does and is involved in, he finds the time to teach medical trainees and others about the very key relationship between climate and health. And his hope is that they will take this knowledge and see how they can support, help, and heal their patients and the community. In his free time, and I don't know when that is, maybe it's when he's sleeping, he enjoys the outdoors, his lovely wife, Jessie, and their 2-year-old Josie, and of course, their dog, Jack. As you can see, he loves anything with Jay. You didn't know I noticed that. A couple other things I want to share, and then I'll take my seat. Today, you will hear not only about Dr. Levy's passion, but also his expertise as he covers 3 particular areas: how climate change impacts our most vulnerable populations, particularly children's health, as well as our EG, environmental justice communities. Also, how healthcare providers can use their roles to lead public health issues from education through completion of patient care. And last but not least, the impact of healthcare's footprint and what we as an industry can do to mitigate the impact on changing climate. With that, if you will help me to welcome my colleague, today's passionate expert, Dr. Aaron Levy.
Good morning, everybody. Oh, that was good. Okay. I hope everybody's had a cup of coffee or two and are ready to go for the day. She mentioned that I have a very busy life, but I think my daughter, Josie, who's about to turn 3, takes up most of the entire amount of my time and energy, and then I leave whatever's left over to do the rest of my work. So, when I think about being here today, I have to look back about a decade when I was in my pediatric training at that time Carolina's healthcare system, now Atrium Health. And the only experience I got for climate health training, input of environmental health on how it impacts our patients, was actually a short presentation through Clean Air Carolinas at the time, now Clean Air NC. About 30 minutes. That was it. And as I come out and look here 10 years later, and to be speaking here today is incredible. And I'm really excited to do this because we've come a long way. We still have a long way to go, but we've come a long way in how we think about this relationship between climate and our patients' health. And so it has to be a part of our education and our training It can't be an afterthought. It can't be a sidebar. It has to be an integral part of it. And so I'm going to talk about some of those things today. Next slide. So this is my little daughter, Josie, my little tree hugger. She reminds me every day about the beautiful interaction between nature and how we perceive it. From looking at a flower and how a bee interacts with it, to listening to the birds and the trees sing their songs, she gives me great inspiration on connecting with nature and how important that is to do. And so we each have a role to play in this climate movement. I feel this climate movement. I feel this climate moment developing. We each have a role. Even little children, little climate advocates themselves have a role. She actually, a few weeks ago when her grandfather was staying at our house, he threw away a banana peel into the trash can and she goes, "No, Papa." She calls him Papa. She said, "No, Papa. Don't throw it in the trash can. Throw it in the compost. She made him pick out that banana peel and put it in the compost. So we have climate advocates down from our little toddlers, but we all play a role. Whether you're a student, like one I met outside, Maya Wilson, who's doing some incredible work, to everybody in the community, to people with different professions and research and science, but individuals leading in their own community, like Ron Ross, who I've known for several years. Next slide. So with every crisis, and this is a climate crisis, comes climate opportunity and climate progress. Progress comes out of crisis. And so we're making some progress. I want to make sure we're clear on that. This is a graph for Mecklenburg County, looking at the number of good air quality days listed in green. And we have made improvements through policy, through behavior change, through work of our Air Quality Commission. And that may not tell the entire story across North Carolina. May not tell the entire story of climate change impacts on health. And it may not tell the entire story of our most vulnerable populations. And so let's think about that as we move forward. Next slide. So the classroom, whether that be indoors or outdoors, it has to start from an early age, making sure that our children and our students are aware of the problem. If we're not aware of the problem, we can't educate on the problem. So I think everybody here today can agree that we're probably all at least somewhat aware of the problem, and maybe we have varying levels of education on the problem, but we have to make sure we instill that from the early age and then going up through students and retraining our adults who have to understand that this is part of the problem, those who lead in businesses and industries. And we have to advocate for policies that help change the way that climate within their businesses and within their industries impact health, especially among those most vulnerable, including children. Next slide. So I want to welcome you into medical school, the future of medical school, where our medical students are leading on this issue, where when I was training 10 years ago, I didn't receive this type of education, but they're asking for it. They're begging for this education and how the environment impacts the health of their patients. And so this is actually a picture from Medical Students for a Sustainable Future, and they say, as future doctors, we recognize the urgency of addressing climate change and the critical need for action. And they're right. And we have to heed their call. And so as we work towards introducing and integrating education into your future doctors and your children's future doctors and your grandchildren's future doctors, let's think about how that will look. So in medical school, we always talk about cases. And in the hospital, I work in the hospital, so I see some of the sickest children who come in, especially those with asthma. And this is actually a child. I've protected her name and actual photo for privacy reasons, but this is an actual child I saw just weeks ago in the hospital. She's a 6-year-old girl with a history of severe asthma, seasonal allergies and eczema, She presented to the emergency department with cough, wheezing, and trouble breathing. She was born premature, 8 weeks early, and she's been admitted to the hospital numerous times in her life for asthma, and twice this year alone. Her family history includes her father has a history of asthma. She lives with her father and mother. She's in first grade. She doesn't have any smoke exposure. And despite being on multiple asthma and allergy medications and being maximized on all the therapies we know how to use, she's still coming in with recurrent asthma attacks. Next slide. So whenever a child comes in with asthma, I usually draw a picture on the board, and you can see here on the left, it's this, could you go next slide, please? Perfect. It's a picture on the left where you can see, basically I draw an upside down tree. You've got the trachea or the windpipe. It branches out into smaller airways, down to the smallest little tiny air sacs where oxygen and carbon dioxide are exchanged and how we breathe comfortably. Well, in a normal airway, as you look over towards the picture on the right, and the left side of that right picture, you can see a nice open airway. And in an asthmatic lung, you can see swelling, mucus buildup, and what we call squeezy airways, usually as a response to a trigger. That trigger, we could probably pull people with asthma in the room, but those triggers are widespread. They include exercise and weather changes, allergies. I'm sure we can all agree on allergies being an issue in the recent months. In addition to colds and viruses, smoking, there's a wide range of lists that can trigger your asthma. And isn't nature, next slide, please. And isn't nature a miraculous thing that upside down tree where we breathe in oxygen and breathe out carbon dioxide, it's just an upside down tree. The same tree that takes in carbon dioxide and releases oxygen as a part of photosynthesis. We are all a part of this harmonious world that interacts. And so we have to think about not just what's within us, but what's outside of us and how we interact with that and how that affects our health. Next slide. So do we have the complete diagnosis in this 6-year-old? I talked to mom about what she feels like triggers her daughter's asthma. She says, yeah, she notices changes when the weather shifts from cold to hot, or there's a lot of pollen in the air, or she has a cold and someone's sick around her. And I asked her if she knew that maybe air pollution or where she lives or the environment around her may play an effect. And she said, I haven't really thought about that. When I asked further, she lives in the Lincoln Heights neighborhood of Charlotte, just north of Uptown. She lives right near I-77. She plays in a park close to the highway. And what impacts does this have on her health? Not only her physical health, but her mental and social health. Well, mom says she has to limit her outdoor play with friends. She's had to miss multiple days of school, secondary to doctor's visits, and even hospitalizations and just feeling unwell. And what does that mean for mom? Well, she misses a lot of work taking her to those doctor visits and taking care of her child. And just think about the mental health impacts that has on the family and the child herself. So I bring up this, next slide. Thank you, Gerald, you're doing a great job. I bring up this book. This is my child's favorite book right now. It's called My Amazing Body. And so we talk about how the body works and how the body interacts. But we talk about how we can't talk about one thing in isolation. The heart doesn't work without the lungs, or the lungs doesn't work without the heart. The eyes don't work without the brain. The muscles don't work without the skeleton. And all these things interact within our bodies. But we also have to talk about how our bodies interact with the world around us, how we're affected, how our health's affected, how our organs are affected by the environment we live in. Next slide, please. So we have to talk about the social determinants of health and the environmental determinants of health, of where we live and where we play. We have to think about where we attend school and the air quality within those schools, or access to transportation and healthcare, and about socioeconomic status. and about the neighborhood we live in, the built environment that we live in. Next slide. And so let's talk about the built environment and the environmental determinants of health. Well, within the environmental determinants of health, we have the natural environment, which is air quality, water quality, tree canopy, among others. But within that built environment, how close do we live to school? What's our access to food? Do we live in a food desert? What about housing safety, traffic and transportation in our community, and how we may be affected by that? And then healthy alternative forms of transportation, from greenways to sidewalks to bike paths, and where these children play, where this 6-year-old plays. Where's her park? Where's her playground? How may she be exposed differently than someone else? Next slide, please. And so I want to draw an analogy. I want to talk about how familiar we are with the health impacts of smoking or secondhand smoke. I think we all know it. We all get a form every time we go to the doctor's office to ask, do we smoke? Insurance forms. Doctors, nurses ask us these questions over and over again. We feel like it's built into our DNA to ask these questions about smoking. But do we ask about environmental effects or pollution? Where we live, how that may affect our health? I think we would agree probably pretty rare. And so the exciting thing is we've made changes in policy on how we've changed the ability to smoke in restaurants and indoors. I'm not old enough to forget being asked about, do you want a smoking section or non-smoking section? And of course, you sit right next to the smoking section, so it doesn't matter anyway. Next slide, please. But here are the effects, just to remind us, if you need reminding, of secondhand smoke. These are people that choose not to smoke, including children. Respiratory disease, worsening of asthma, even sudden infant death syndrome, and in adults, a broad list, including strokes, lung cancer, heart disease, blood vessel disease. These are things we all know and are preached about. But what about air pollution? Well, this is just a highlight, so this is not the full array of effects from air pollution, but it goes throughout someone's lifetime, even within pregnancy. From low birth weight and prematurity, to asthma exacerbations or attacks that we talk about, to an adult's heart disease, strokes, lung cancer, worsening of COPD, diabetes, and even dementia. Next slide. But even broader than air pollution, what about climate health impacts at a larger scale? We have to think about these things. So we know that the world is warming. I think we can all agree on this as a fact. We know that the number of days that we're going to see over 90 degrees is increasing year after year or decade after decade. Next slide. And what does that mean for our children? Children in particular are especially vulnerable to the health impacts of direct heat-related illness. In our infants, we see that they don't have an ability to regulate their temperature as well as other people. So they may be more prone to dehydration, electrolyte abnormalities, and come into the hospital for those reasons. And then athletes, whether it be youth sports, middle schoolers, high school students, college students, football players doing 2-a-days during the summer, we've seen increased emergency room visits for heat-related illness, such as heat stroke, and then secondary effects from kidney disease. And then allergy seasons, one that we probably all feel. They're becoming more intense and longer. It started in February this year in North Carolina. Ragweed itself increases with higher levels of carbon dioxide and higher temperatures, and it worsens some of those underlying issues such as eczema, seasonal allergies, and asthma that cause us to have some of those symptoms, including itchiness, sneezing, watery eyes, cough, trouble breathing. Next slide. And then infectious diseases. We know that with warming climate, we are seeing an increased geographic spread and increased propensity of mosquito-borne and tick-borne illness that we used to think were illnesses sometimes only seen in countries outside the United States. But we're seeing an increased increased incidence of West Nile virus, dengue fever, Zika virus, even Lyme disease heading more northward into warmer climates because of some of these changes. This is not an exhaustive list. Increased bacterial and parasitic infections that cause diarrhea, again, especially in our most vulnerable populations, and then toxic algae that contaminates our waterways where children play, kills our wildlife, and can have effects on humans and their pets. And so you may see more signs that say, don't play in this water due to this toxic algae. Extreme weather events. Goodness, I can't go on the news any day now without seeing extreme weather events that are becoming more frequent and more intense. From hurricanes to floods to droughts to wildfires, even as far east as North Carolina. It's not just a West problem. And the primary impacts from that. My wife works in the as a social worker for the trauma department, so she sees some of these patients that receive some of the direct impacts from these injuries, or even just cleaning up the debris from some of these extreme events. We had a patient who got a traumatic brain injury from taking down a tree that got damaged in a recent storm. And then we have to think about the secondary impacts. From home and community damage, people taken away from their schools and their neighborhoods, the effect on air quality from wildfires, the effect on water quality from floods, and then secondary mold that contaminates the streets and homes. Next slide. And then we think about the mental health impacts. An epidemic in its own right, a children's hospital filled with patients admitted for mental health. We can't exclude climate change from part of the conversation. Children who flee from extreme weather events, call them climate refugees. This is a picture actually from Katrina, but the examples are numerous. Where they get uprooted from their homes, uprooted from their schools, uprooted from their friends, and have to move to different cities or towns in order to escape the ruins. And think about the post-traumatic stress effects from that. And then there's eco-anxiety, where people, including young people, are worried about the future, are worried about where the direction of climate is heading. But what I'm so optimistic about among these crisis situations is that it's our young people, our youngest people, and our students that are leading the charge on this. That's why I'm optimistic. Next slide, please. And let's talk about food insecurity. Floods and droughts are leading to decrease in crop production, even wiping out entire crops that may sustain an economy for rural areas or certain families. And then the downstream effects on the supply chain, and then already limited access to food. And then we also know that climate change is impacting nutrition within those crops itself. It can decrease certain nutrients in crops, including protein, zinc, and iron in certain crops. And so this has big and wide-ranging effects on our food. And then air pollution. This is a talk in itself. But I'm going to highlight some of the most important things that I want to make sure that we highlight here. Ozone, something that helps form smog. As a reminder, not to get too technical, but it's formed from other chemicals and pollutants in the setting of heat and sunlight. And it's formed from some of these sources. In Mecklenburg County, we see it formed from automobiles, trucks, trains, farm equipment, construction equipment, but across North Carolina also from power plants and industrial sources as well. We know that ozone has a direct impact on that 6-year-old's lungs. It increases the use of rescue medicines for asthma, increased emergency room visits, increased hospitalizations. It's hard to pinpoint what role it plays, but we know it plays a role. And so are we doing enough to help prevent this child from continuing to get sick from a deadly disease? And then particulate matter, also known as soot. which has got a lot of attention because the Environmental Protection Agency is looking to reduce the standard and make it more strict to be regulated. It comes from industrial and mobile sources as well. It is a direct airway irritant. It can get inhaled deep into the lungs and cause asthma attacks. It can also cause attacks or worsening of chronic obstructive pulmonary disease or COPD in adults. It can even enter the bloodstream and cause blood vessel disease and heart disease. You can see here it's really, really small in that top right picture, smaller than a width of a human hair or a grain of sand. These are important pollutants that we have to think about and continue to monitor. And what about the impacts on maternal fetal health in newborns? With warmer temperature, ozone, and particulate matter or soot, we see increased rates. The evidence shows we see increased rates of prematurity and lower birth weights. And what does that have as secondary impacts? We know that premature children, especially the most premature, suffer from lung disease, suffer from feeding problems, developmental delays. These are not in isolation. They have downstream impacts on the children's lives going forward. And we can't ignore the health disparities that exist. Premature birth rate is over 50% higher among black women than white women. Let's talk further about those things. Black Americans are nearly 1.5 times more likely to have asthma. Puerto Rican Americans are nearly 2 times more likely to have asthma. Black Americans are 5 times more likely to visit the emergency department and 3 times more likely to die from asthma. And we consider gender as a factor. Black women have the highest rate of death due to asthma. So when we think about this 6-year-old child, let's think about this. Next slide. We do have environmental injustice. We do have health disparities, health inequities. And they're not new. I think you all know this, and I know it will be talked about further. But they stem from historic discrimination practices that devalued properties and neighborhoods in Charlotte decades ago and continue to contaminate the lungs and bodies of the residents living there today. You can see here in the picture on the top, I-77 ripping right through the Genesis Park neighborhood in Charlotte. As these things develop, we form urban heat islands, heat trapping asphalt, decreased tree canopy, dense traffic, areas that are more prone to some of these climate health impacts. Next slide. And so let's look at some of this mapping. If you can follow along, the darker areas of blue and green represent where people who identify as Black or African American reside. And we can see here in the west, north, and east parts of Charlotte, right around Uptown. Next slide, please. Well, what about proximity to traffic? Again, if you look at the darker areas, the west, north, and east parts of Charlotte are the most dense areas of traffic where the south is typically spared. Next slide. And what about that low birth weight and the effects on our youngest and most fragile? Again, we see that low birth weight, highest propensity in the west, north, and east parts of Charlotte, the same areas where African Americans and Black people reside. But let's reverse the map a little bit. Next slide. What about life expectancy? You can see here that the darkest areas for the longer life are in that reverse map. And so I'm not saying that environmental pollution or climate change itself is alone responsible. It is part of the problem. It is a factor in the problem and has to be part of discussion and policy making going forward. Next slide. So what's the great paradox here? Is that the healthcare industry I work for, not Atrium Health, but the greater healthcare industry, is part of the problem. 8.5% contribution of greenhouse gases come from the healthcare industry. 8.5%. We are basically putting toxins and cigarettes in the patient's mouths that we're trying to treat. U.S. hospitals are the second most energy-intensive facilities after food service, and We generate in hospitals in particular about 30 pounds of waste per patient per day. So we're just starting to make changes though. We're actually doing something about it, which I'm excited about and I'm optimistic about. We're trying to reduce our emissions. We're looking at our supply chain. We've at Atrium Health have pledged for the Health and Human Services Climate Health Sector Pledge to get to net zero by 2050, but reduce to half by 2030. Next slide. Let's look at that healthcare footprint and what may exist as part of a working hospital. From generators to anesthetic gases that put out toxic emissions, to lighting and electricity and ventilation, to office supplies and supplies that go into labs and patient care, to cafeteria waste and food waste, to automobiles and transportation. We are part of the problem as a healthcare institution. And so we have to be part of the solution. And so I can only speak from a physician level, and I'm, as we poll physicians, this is out of one survey, to ask what do most physicians think about climate change? Well, the majority agree that climate change is directly relevant to patient care, that we have a responsibility to educate patients about the health impacts of climate change, and that we should encourage our healthcare system to be more environmentally sustainable. Okay, we can all agree on that. But we also bring up barriers. People say that we're already busy and there's so many time constraints to address all the needs of patients' health. We may have a lack of knowledge or personal training, which I'm really passionate about changing. We have a perception that climate change is controversial and discussing it with patients may not make a difference. Next slide. Well, I argue that it does. I think we can all agree that it would. And so I encourage you and I challenge you to ask your doctor or your child's doctor, talk about climate change. Ask how it may impact their health. They may be knowledgeable about it. We have a growing network of physicians that are passionate about this topic and making it part of the conversation, but they may not. And so I guarantee you there's not too many physicians out there that don't like to know the answer to something. I can speak for that myself. And so they're gonna go look it up or they're gonna find out how. And if they ignore it or say it's not a problem, I would challenge you to challenge them. Next slide. So what does the American Academy of Pediatrics recommend? That's my governing body as a pediatrician. Well, they've actually been leading on this issue, by the way, from the start. So I'm excited to be a part of this group. They support the inclusion of climate and health in medical schools, and that's where my biggest role, I think, comes. Making sure that our future physicians are trained to talk about climate change as they talk about smoking. They also recommend reducing the environmental footprint of healthcare facilities and advocating. Advocating for accessible public and active transport where the kids will walk and play and bike, green spaces and tree canopies to make sure they're protected, and then making sure we educate and outreach to our most vulnerable populations. Next slide. And so as part of that outreach, or at least awareness, we have to talk about the air quality index so that our patients, especially those that have asthma or underlying health disease, know when they may be most at risk. And so you can now look at it in multiple areas. You can go to your iPhone right now and look at your weather map, scroll all the way down, and you can see the air quality index right now, just like you would the weather forecast for the day. You can also go to Google Maps, and you can do one of those layers right next to the satellite where you can see where the air quality is in your neighborhood or close to your neighborhood. You can go to airnow.gov, which is one of the websites that has all the information, and you can go to www.enviroflash.info. You can do it right now if you want. You can do it later. Sign up for health air quality alerts. Basically get a notification so you don't have to think about it. And the reason I circled the orange here because it's one of the most, it's the early indicator of when a child or other vulnerable populations or sensitive populations may start to experience poor health effects. Those red days and purple days are obviously severe too. Next slide. And so what am I doing? What is my role in this? Well, climate health education is where I feel most passionate. I always thought about being a teacher, and when I realized I could be a doctor and a teacher and fulfill two of my passions, then I knew I was on the right track. We just had meetings in the past week to incorporate climate health as part of medical training for the future Wake Forest University School that I'm a part of. We have to make this part of the normal training so that it's not an afterthought. And then continuing to outreach to communities, local communities, to make sure that their voice is heard and they're part of the conversation as their neighborhoods are the most affected. Next slide. So let's come back to this 6-year-old. History of asthma, came in with trouble breathing. I know what role I play in this, and my medicines will not help alone. I promise you that every one of you plays a different role. I've talked to people already this morning who are working at different levels and different professions and different interests. You all have a role to play, and so as you listen and hear from our incredible panel of speakers and reflect, I encourage you to ask yourself, what's your role going forward in this climate health moment, this climate health movement? Thank you.